I work with some pretty amazing people at NHTI in the dental hygiene department, and actually all across campus. Any person that I've come into contact with, either on a committee or working on a project, have one thing in common. They are all dedicated to student success. It just oozes out of them. And everyone in our department goes above and beyond to provide additional resources to students or really cater their courses to what the students really need. I find myself every year that students have different challenges with different content. And so I try to develop all different types of teaching strategies and activities that work to meet those needs. And my friend Rachel, who I work with, who's on this episode, is very much like that. She's super creative, she's brilliant, and she teaches pharmacology and radiology at our school. And we are so very lucky to have her. And I was really excited when she decided she was going to put together some stuff to get on this podcast and really spread some of her knowledge about some of the topics, the tough topics of pharmacology. So I really hope you enjoy this episode. Anytime I have time to spend time with Rachel, it's a good time. So take a listen. Hi, everyone. Welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome. So glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. So I am so excited to have Rachel Leo Flagg on the podcast today. I work with Rachel, and she's one of my favorite colleagues, and she's just become a personal friend after all these years of working together. And she is just an expert in pharmacology and all things radiology. And she's decided to take a little bit of time out of her busy schedule and share some of her really amazing teaching strategies and knowledge and quick tidbits on how to remember some of the complex parts of pharmacology. And specifically, she's going to just tackle a really tough topic today. So, Rachel, welcome. I'm so glad you're here.
Thank you so much. I'm not an expert, but I have been teaching pharmacology for a very long time. So I really try with my students to give them hints on how to remember drugs. So today we're going to talk about benzodiazepines and barbiturates. Kind of an easy way to start off as far as remembering them is they're kind of on the opposite spectrum as far as therapeutic effect and their abuse tolerance and overdose. Benzodiazepines really has replaced barbiturates. The most notable barbiturate is phenobarbital, which is used to treat seizures. It's really, barbiturates are pretty heavy duty drugs and they're not so much used anymore. You do see them used in general anesthesia, but ours like everyday use, no. So again, the benzodiazepines have replaced them. So we have benzodiazepines, which are sedatives, and barbiturates on the opposite spectrum, which are sedatives, but hypnotics. And in the pharmacology world, hypnotics basically means like to induce sleep. They both, as far as their mechanism of action, they both work on GABA receptors. And GABA is gamma aminobutyric acid. And so that's a neurotransmitter. It's a chemical messenger in your brain, and it slows down your brain by blocking specific signals to your central nervous system. So really, benzodiazepines and barbiturates are central nervous system depressants, but they're also respiratory depressants, and that's a real concern. And so when we look at our patients and we want to, they're having difficulties and anxiety, and you want to determine what to prescribe, the number one thing, and it's a big thing of mine, is to always look at the patient's medical history, because you don't want to give them a drug that's going to give them an additive effect of sedation or enhance other adverse effects of benzodiazepines. So for instance, a big one, well, alcohol, so you don't want to mix benzos and obviously barbiturates with alcohol, because it's a central nervous system depressant, but it's a respiratory depressant. So if you're thinking about benzos and barbiturates, benzos are CNS depressants and respiratory depressants, but barbiturates are on like the opposite spectrum, where they're have profound effects on respiratory and central nervous system. So they both, as far as their mechanism of action, they both have to do with GABA. So that's really easy to remember. And their pharmacological effects are very similar. So they're going to reduce anxiety and panic, which anxiety is a big factor in dentistry, because it's what sometimes brings people to see us, but it's also what keeps people away. So they both cause sedation, and that can be a good thing, a pharmacological effect. So some benzodiazepines are used for sleep. And there's many different types of classifications of benzodiazepines, which we'll get in later. But I always tell my students too, when you're trying to remember adverse reactions, are exaggerated effects of their pharmacological effects. Okay, so so adverse reactions are extensions of pharmacological effects. So that's a good way to remember their pharmacological effects and adverse reactions. So we have pharmacological effect, sedation. Okay, so that can be an adverse reaction. Okay, benzodiazepines also can relax muscles. Valium is a really good medication that is used especially for the TMJ. When someone has TMJ issues, Valium is a good benzo that helps relax the muscles. Barbiturates aren't prescribed for that. Like I said, they're really for general anesthesia. Barbiturates have a very high potential for addiction, tolerance, and overdose. Benzodiazepines they can be abused, and people can get addicted to them, but they're really prescribed short term. So if someone is on a benzodiazepine, hopefully they're not on it, for life. That would be troubling, because they're addicting, but so they're really prescribed short term. So if we get to their adverse reactions, again, I talked about they both cause sedation, respiratory depression. They both do that, and CNS depression. They can cause xerostomia. And one thing with benzos that's different is particularly halcyon, which is triazolam, which can cause what's called amnesia, interrogate amnesia. And interrogate amnesia is something that you're not going to remember the next few hours of what's going to happen, as opposed to retrograde. Okay. So halcyon is given in dentistry for conscious sedation. And it's a really good drug because patients don't remember what has happened. So many times, when in my office that way I worked in, we did do conscious sedation, and we always called the patient, said, we're just calling to see how you're doing, how you're feeling. And they say, geez, I didn't remember a thing. So that's a good thing. However, pharmacological effect, but an adverse reaction, you have to be careful with people who are really sensitive to perhaps halcyon, and also informed consent. Okay, which I didn't really talk to my students about that because, I try to focus more on pharmacology, but I just want to mention that you need to get informed consent because it can be kind of a troubling thing, because someone could say, well, my blouse was unbuttoned, so they could accuse the dentist for, where I'm going, right down the
I
road.
do. I can just see a board question case study with everything you're saying right now, all kind of tying together for those clinical considerations for these drugs.
Yes. Yeah. And so, um, getting back to the benzos and the barbs, again, they're kind of like opposite extremes. You have to think about barbs as more profound effect. So they have a lot of drug interactions. They're kind of different. Benzodiazepines can decrease the metabolism of tagamet, isoniazid, which is treated for treatment of tuberculosis, and omeprazole, which is a stomach medicament for GERD. So when we say decrease the metabolism of benzodiazepines, that means that it's the benzodiazepines are in the person's system longer. And when a drug is in somebody's system longer than intended, because another drug is decreasing the metabolism, it can cause toxicity and adverse reactions. Benzodiazepines can decrease the effects of levodopa, which is used for Parkinson's disease, and increase the effects of digoxin and dilantin. So when we talk about increase the effects, it's going to increase the therapeutic effects of digoxin, which is for congestive heart failure, and dilantin. However, right, it can cause more adverse reactions. So again, to go back, I'm a bit big about medical history, is whenever something is prescribed, you have to go to the medical history, right, to see if there's any drugs that are going to interact or have an additive effect. Okay. Valproic acid, benzodiazepines can increase the sedative effects of valproic acid. That's used to treat bipolar. And SSRIs, which are used for antidepressants, they can increase diazepam levels, and diazepam is Valium. Okay. Mm-hmm. And again, additive effects, any CNS depressants, any, opioids, right? Anything that's a CNS depressant, a respiratory depressant, we have to really be careful of. So the barbiturates, one thing I want to say too, as I talk to my students, is when we talk about safety of these drugs, barbiturates have a very narrow therapeutic index. And, we've talked about, like, okay, what is a narrow therapeutic index? Well, there's more potential for overdose. Okay, so there's not a lot of dosages that you can fool around with because it's so narrow that, it can be a real, safety issue. And dentists or doctors have to really, really, really be careful when they're prescribing. Benzodiazepines have a very wide therapeutic index, very wide safety profile. So there's, more dosages they can, right? They can prescribe, and it has, it's more safe. Is really what it is. It's a therapeutic index. It's all about safety.
That's a really good concept for students to understand. And that's nice that you have both of those on the opposite ends to explain that concept to them.
Yeah, because it's, some drugs are really, I don't want to say unsafe, but their therapeutic index is really narrow, and there's not much, you can do to play around, with
they're sensitive to that.
Right. So, getting to the barbiturates, talking a little bit more about the barbiturates, they have drug interactions. And, it's really hard for students to remember all these drug interactions. And I totally get it, right? When we have pharmacology, it's very overwhelming. But, unfortunately, the boards have drugs on them, and we have to know, right? We have to know the drugs. We have to know these things. And as far as drug interactions, there's a lot of times there's just no easy way to, to remember them. Barbiturates do have a drug interaction with dilantin, which benzodiazepines do share that, but they also decrease the effects of beta blockers, which are used, right, for hypertension, and oral contraceptives. They decrease the drug act. So what does that mean? Well, that means that your oral contraceptive isn't going to work as well, right? So if anybody's on a barbiturate, which really is very rare, okay, there's, again, phenobarbital used for epilepsy, but you don't really see it that often. Actually, phenobarbital is used more in veterinary medicine for animals for, anxiety, but we really don't see it that much. Again, general anesthesia is where you would see it. So they do have a drug interaction with doxycycline, steroids, Coumadin, tricyclic antidepressants. I know the list goes on, but we do have to know that. And it can increase the effects of Darvon. Darvon's is a pain medicine, really not used that much. And then the MAO inhibitors. MAO inhibitors have drug interactions, food interactions with so many drugs, and they're really not used anymore. They're really used more maybe in a hospital setting. So, I tell my students, when you see a question on, a drug interaction, and MAO inhibitors is one of the answers, you can almost guess what the answer is going to be, because they pretty much have a drug interaction with many, many, many drugs. And then, of course, opioids, and alcohol, any CNS depressant and respiratory depressant.
That's a long list. I can see how that would be overwhelming for a student to try to remember all that.
Yes, and looking at students, they're like, oh, I have to remember. And yes, you do, but when you get out in private practice, right, there's references, you can look at. I do want to talk a little bit about more about benzodiazepines, because there's different types of benzodiazepines. Benzodiazepines, there's something called non-benzodiazepine receptor hypnotics. I'll get into that. Non-benzodiazepine, non-barbiturate sedative hypnotics. Who comes up with these?
Long words. These long words, those are even harder for students to remember. It's not just the different lists of things, it's the names of them as well.
Right, exactly. And so when we talk about the non-benzodiazepine, non-barbiturate sedative hypnotics, so there's Buspar. Buspar is kind of in its category by itself, and it doesn't have the adverse reactions of like a typical benzodiazepine, but it's really used for relief of anxiety. I see it more and more on medical histories. I see it on medical histories used when you talk to a patient, or even actually people that I know, they use it more PRN. And it really doesn't have that adverse profile as benzodiazepines. It really has an unknown mechanism of action, though they do say they interact with serotonin and dopamine receptors, but there's no sedation or impairment of performance, doesn't have an additive effect with alcohol, there's no tolerance or withdrawal, and there's no abuse potential with Buspar. Now, there's another class called non-benzodiazepine receptor hypnotics, and that's a group of drugs that treat insomnia. And they bind to benzodiazepine receptors, but they decrease sleep latency. So what is decreasing sleep latency? Well, I can't fall asleep, right? I don't fall asleep till 3 a.m. And so these drugs, which I'll get into some of the names, is, just help decrease sleep latency and there's also, it helps, some people say I wake up and at 3 o'clock in the morning and then I can't get back to sleep. And so these drugs, they're Ambien, Sinesta, Lunesta. Those are all drugs used for short-term treatment of insomnia. Well, I'm going to talk specifically about the benzodiazepines, like, the names of the drugs and some specifics. So here are some examples of benzodiazepines. So we have Librium, which is actually a first generation. It's really not, you really don't see it anymore. Do you ever see that?
No.
I never see it. And then there's diazepam, which is Valium, lorazepam, which is Ativan, alprazolam is Xanax, and we have Versed, triazolone, which is Halcyon. And so those are some examples of benzodiazepine. So Valium, right, Billy, we see Valium
A lot.
a whole lot.
Yes.
And Valium can be troubling taking long-term. There's a lot of long-term, adverse reactions. But as far as using it short-term, it's fine. It's very often used, right? You've probably seen it for a preoperative, for patients that are very anxious.
Yeah.
Right?
It really helps them build their confidence because they don't
Uh,
recognize the impact of the medication. They say, "Oh, see, I did great today." And they kind of forget that we've prescribed them that.
That's a really good point because that makes me think of a patient I had to come in on Valium all the time. And then one time she came in and I asked her, I said, "Did you take your Valium?" She goes, "Nope, I didn't take it today." She says, I don't think I need it anymore." I
Yeah.
was so proud of her. And she did great. She did great. So
It's a great example of a medication that can really help patients overcome dental anxiety because they have still a really good awareness of what's going on, that memory's there, but it helps them build the confidence and overcome that fear.
yep, you're so right. I've seen it so many times, so many times. And then Xanax sometimes I've heard can be used in dentistry instead of Valium. Xanax highly addicting.
Mm,
Xanax it's a little different than Valium. It has a quick onset, quicker than Valium, but it's really short acting. But it's, I've never, have you seen Xanax used in a dental office?
I haven't. I think
I haven't.
Valium is kind of the go-to. Take one the
Right.
night before and then the morning of kind of, yeah.
And then we have Versed. I've seen used in pedo. If you work in a pedo office, you'll see Versed. And Versed is often used for pre-op for surgery. And then we get to Halcyon, which is, good in some respects, but troubling in others. So, I know I already talked about it, but, I have seen Halcyon and used for conscious sedation. And again, talking about the amnesia effect can be a pharmacological effect, but also an adverse reaction. Okay. So again, telling students, how do I remember pharmacological effects, adverse reactions? Again, think about adverse reactions are extensions of pharmacological effects, or you could say exaggerated effects. Okay.
Mm,
So that's a really good way for students to kind of remember. And I try to get them to link, right? Where are the links? We just did concept maps so they could see the links. Some students, that's really good for them. It helps. And some students, it doesn't. So it's really, we kind of, teaching, Billy, we just sort of put out a variety of things for our students because every student, has different learning styles. But when you look at, you can do concept maps with any drug or a classification of drug. And it really does, it's helpful to see the links because a pharmacological effect. So say we want a benzodiazepine, right? It causes relaxation, decreases anxiety. Okay, so then you come on a question, what is it used for? Well, think about the pharmacologic, it's right, used to
yeah.
reduce anxiety, okay? Or you want it for sedation, or you want it for sleep. Sometimes Xanax actually can be used, prescribed for people for sleep. Well, that's a use, right? So if you can make these links and relationships with the pharmacological effects, adverse reactions, uses of drugs, and sometimes even the mechanism of action, it can help you understand the drug and remember all these different factors about drugs.
That's a really great suggestion because a lot of our students in dental hygiene are hands-on learners. And so I do think a concept map is probably the closest you're going to get to like a hands-on activity that will kind of connect the dots for you in your brain.
Right, connecting the dots. That's really big. It's not, pharmacology is not like I teach radiology. Okay, what are the parts of the X-ray machine? Okay, that bim bam, you got your answer. But drugs is a whole other, right? Just a whole other spectrum of just you can't just study like parts of the machine. So it's really helpful for students to remember, right? The links and the relationships, connecting the dots to help you remember, okay, all the factors
Yeah.
about the drugs.
I found for myself, and I don't know if this is how you learned it. I found that when I had patients or when I went on my community rotations and I was looking up the medications and then I could attach those medications to the complications those patients were having or
Yes.
the systemic illnesses they had been suffering from. I could finally connect those really hard words of the drug names to the conditions that the patients had, or maybe even stuff that I saw in the oral cavity when I was looking at them to help with the side effects, right? So it's like a concept map in the clinical setting that you're making.
Right, that's so true. And when I was a student too, that's how I was connecting the dots too. And we have a medication worksheet in our clinic, and it's tedious. The students have to fill out, especially if the the patient comes in with 20 meds.
Yeah.
The student sort of like looks at you. Do I have to do all? Yes, you do. But this is a way for the students to learn the drugs and make connections, right, with diseases and disorders that our patients, come in with. And as a student, we had to do something really similar. And again, like that's how I was able to connect the dots and learn about medications and their side effects and uses. Because sometimes a patient would come in with a drug or with a disorder or disease, and they would be put on this drug. And I don't know about you, Billy, but sometimes we're like, what is going on? And I never learned that that drug could be used, right, to teach, and that could be like an off-label use. And then lo and behold, as years go on, it ends up being, right, one of the
Yeah.
drug choices to treat that disorder. So, yeah. So again, yep, connecting the dots,
It
making links.
is. You have to learn it for the boards to begin with, but then when you start relating it to real patient care and you see how important it is for you to know the information so that you are connecting the dots and helping patients through that process of care, then it becomes more real. It's way more important than just a board question, but
Right.
in the moment of where students are at learning, it's a lot.
Yes, it is. Pharmacology is a lot. And talking about patient care, when our patients come in too on sedatives or benzodiazepine, there are some factors that we have to think of. Well, first, I talked about the medical history. What types of medications are the persons, that patient is on to make sure that we don't have any drug interactions or an additive effect. So we have to review the medical history to see if there are any contraindications because, these meds are sedating, right? And we have to counsel our patients about, right, about the therapeutic effects. You're going to be sleepy. In that case, someone has to drive them in and someone has to drive them home. And as a clinician, you're talking to the patient about this. You have to make sure because one of my patients drove themselves in one time.
Oh my gosh.
And I wouldn't let him go home. Right? I said, "You need somebody to pick." I think he went home in a taxi. Actually, I think we paid for him to go home in a taxi. But yeah, you cannot have people drive, on sedatives, right?
For sure.
The other thing, don't sign important documents, don't operate machinery, and these drugs are absolutely contraindicated for pregnant women. It causes cleft lip malformations of the lip and palate, and there's no pain relief even at sedative doses. So this is a classic board question.
Yeah.
Okay. right? So do benzodiazepines or barbiturates? I have actually had an example of that question in the PowerPoint. But are they used for analgesics, for pain relief? And they're not.
Mm.
They're not, and that's like a big classic, classic question. So that's one thing I have it say it periodically through my lecture. And then, analgesics, are necessary, counseling the patient on it, what to do. And you should have post-operative instructions because the patient's not going to remember, especially if they're on Halcyon. You got to talk to the person that brought them in. Again, have post-operative instructions, and, non-opioids are preferred. And the other thing I just want to mention is that it's not a substitute for patient management. Okay, so you have a difficult patient. Yes, they have a phobia, but maybe, or they have anxiety, but maybe, when I say difficult, I don't mean difficult anxiety, but just a patient who is very resistant, I guess you could say, to any recommendations that, we have. Um, you have to sit and educate and talk to those types of patients. And, you might, and sometimes patients with anxiety, as you know, Billy, like they come in and you just, you have to, I talk to my students, you have to really provide a very calm, serene atmosphere. You have to make sure that they know they're in control of the appointment. Give them the suction. We have to think about, some of our patients are trauma survivors of sexual abuse. Anything in their mouth is just very, PTSD, very, anxiety producing. So we have to sort of, we have to make sure that they know that they're in control. You can stop, I can stop anytime you want.
That's a good point, Rachel. We have to respect that we're in their personal space and really appreciate how they present themselves.
Yes, super important. And so we want to provide the least stressful atmosphere. I talk to the patient, my students too, is that, sometimes we can do non-pharmacological methods. Okay. So again, it's not, we can't use these for patient management, right? So we can provide maybe non-pharmacological methods for a patient. And that could mean a lot of different things. Right. So it could mean music, right? They're listening to music. There's a patient of mine. Oh my goodness. I talked to my students. He used to come in every time. He had a Walkman. I don't know if people know Walkman. And he used to listen to Metallica and the
Yeah.
Blacks. And I would hear this boom, boom, music, and I'm trying to scale. And that was relaxing for him. Okay, that
Yeah.
would not be relaxing for me.
No.
So,
Little Metallica during your hygiene visit.
oh boy. Yep. Yep.
And you weren't using medication. He was using his Walkman.
And so this is, again, not using this for patient management, but Black Sabbath and Metallica, man, that was his jam, and so he would just do, and hey, whatever works, right?
That's
Whatever
right.
works. One office, we had this hand. It was like a stuffed animal, a hand. And this woman was selling these. I can't remember. It was kind of maybe in the 90s kind of a thing. And they used to hold this hand,
Interesting.
yeah, it was all, so there's lots of non-pharmacological, people had those glasses, those, so there's spa, dentist, dental offices. So there's lots of different, pharmacological methods we can use. But the number one thing that we have to do as clinicians is we not only have to provide the least stressful environment, but we have to be compassionate, which you did, touch upon that. Compassionate. We have to have empathy. We have to have active listening, tuning into the dental fears. And the last thing I'm going to say is, this is part of my master's thesis, is that there's a whole, I tell my students, you have to be really careful with patients. There are what's called blunters and monitors. There are patients that they want to know every single thing that you're doing, right? And we should always tell our patient before we perform, right, to inform them of what we're doing. And then some patients want to know at every step of the process. Okay, those are monitors. But blunters, are like, just do what you need to do. Like the guy with the Metallica, it's okay, he was a blunter. Okay, he didn't want to know what I was doing,
Yeah.
just do it. And I have to say, I'm kind of a blunter too. Just Just do what you have to do. But there's also, and high monitors, low blunters, I did my thesis on that. But I tell the students that you really have to try to figure out if your patient is a monitor or if they're a blunter. Because if they're a blunter, you're going to just send them through the roof with anxiety by telling them every step of, what you're doing every step of the way. So,
That's a really good point, Rachel, because if you can have that on in your brain to figure out what you're dealing with, it really helps you with your approach to be more, targeted.
right. And in school, we were taught, tell your patient, inform before you perform, tell your patient what you're going to do. But, when I was thinking back at some of my patients that I could think back as blunter, especially that particular, gentleman, but patient. So, you are always supposed to tell them what we're going to do, but some patients don't want to know. They just
Yeah.
do it. So we have to really be cognizant of that and try to pick up on that so we can, um, you know, decrease the anxiety, of our patients.
Well, as always, Rachel, you always give great information in the most clear and concise way. I do want to ask you, because I'd like to share it with our listeners, what made you want to become a dental hygienist?
Oh, okay. So, hmm. Well, I had my teeth I was in high school and had my teeth cleaned, and I had a really good hygienist. And, she was really thorough with me with, oral health instruction. And I had braces, I remember, and I wasn't the best at cleaning, around. I mean, back then we had these brackets around our teeth, and
Yeah,
it's just,
those
you know,
were
I
braces.
I still have indentations in my molars with those brackets, but, those were hard to clean, just with regular brushing. You really had to brush. But anyway, she was really thorough, and I started to think of how wonderful, like, her job was to be teaching, you know, the public or patients about oral health instruction. And I realized after she was talking how, like, important it was. And so I went home thinking about it, and I didn't start off that way. I started off in business and marketing, and I hated it. And I went back to my guidance counselor at school. It was only one semester, and it was like business. And I went back and I said, I want to be a dental hygienist. And, he even asked why, because I don't know, I was just really, I can't think of the word, but she just really struck me as being like someone really important, right?
Yeah, and
For
she was.
the medical field, medical and dental field. And so she really, that inspired, that's the word. She really inspired me. So, and I just got thinking more and more about it. And I have to say, we have a lot of healthcare
Yeah,
people in my family. So, um, nurses and a doctor. So I kind of steered into, the healthcare, I guess you could say. Yeah. So it was my dental hygienist. She inspired me.
that's awesome. Well, to know you is to know an inspirational dental hygienist, Rachel.
Oh, you're
You
so
are that for the next group. You really are.
well, very kind. Well, I hope I can provide more podcasts on some drugs for you and help students in remembering all these drugs that we have to memorize.
Yay, I'm looking forward to another episode with you, Rachel. Thanks for tuning in. I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.